I have a special episode of the podcast this week. I'm actually sharing an interview I did back in February for my membership with Dr. Kelly Blodgett. He is a holistic dentist, and it was so good that I was like, I really want to make this into a podcast episode. And he was so gracious with his time, and he just really wants to get this message out. So I was like, I'm going to put this into a podcast episode. If you do not follow him, he's at Blodgett Dental Care on Instagram. I can't recommend it enough. I've learned so much even just from his Instagram. And then when I had him on, I was asking him a ton of questions that women in my membership had submitted. So it's a long interview, but I promise you that it is worth it, and you're going to gain a ton of knowledge. We start off with talking about things like cavities and understanding decay and all that kind of stuff, and then we move into things like teeth grinding, getting to the root cause of that. Lots of like common issues that we have women struggle with inside our group. And then, of course, we do touch on root canals since that is what he is known for. But yeah, so I'm going to let you dive into the episode, but really quick, because I don't go through his background with him since everyone in my membership already knew who he was. Dr. Blodgett, he's from Oregon. He still lives in Portland, where he went to high school to this day, with his wife and two daughters. And he has a cool background. So he originally went to school. He got a bachelor's in psychology, which I just think imagine if more doctors did that. Like what I feel like that impacts his work a lot, and you'll hear him talk and kind of get what I mean. But when he went to dental school, he got voted for going the extra mile award from his classmates. And again, like as soon as you hear him talk and explain things and like the care that he takes when he talks about his patients and just people in general, you'll understand why he got that award. But he's very well known. He's super successful. He's become a recognized leader in minimally invasive dentistry, dental lasers, computerized dental technology, and holistic care. He has been featured in a bunch of different dental journals. He's been on TV, he's been in magazines, all based around like how he practices. I think we throw around the words like holistic dentist or biological dentist a lot, but they're not all the same. So that's something to keep in mind. And we talk about that at the end of this episode, where we talk about like how you can find someone like him. But he truly is a pioneer in progressive dental care. And he's just like someone that I look up to as a practitioner as well, just like the care he takes with his patients. So the reason he's so appealing to me is because of how he practices, and he wants to know everything about a patient, right? He's not just looking at their oral health, he's looking at their entire mental, physical, emotional health history and where they currently are right now. And he's always trying to meet someone where they're at. So when I ask him specific questions in the interview about like cavities and different therapies that you can try for different things, it's always like, well, you could do this, but you could also do X, Y, and Z. It really depends on like what you have going on and what's going to work best for you. So I think it's easy for practitioners to give blanket recommendations, and at times we have to because we're trying to help a large number of people. But I appreciate that really individualized approach that he takes, and just how much care he puts in there. So I'm excited for you guys to listen to this episode really quickly because I know I'm going to get questions about it. I talked about how I had him in my membership. So I don't talk about my membership a lot. It's mainly because you can only join if you're in my course. So if you've gone through the Master Minerals course and you need more support, that's what I made the membership for. So it's monthly membership. You can cancel at any time. And it's really based around this community we have inside an app called Circle. It's like Facebook, but it's not. So it's amazing. And it's easier to organize and all this stuff. So we've got this Circle community. I do office hours twice a month. We have a guest expert like Dr. Kelly Blodgett come in 6 times a year. So we try to do it every other month, but with my maternity leave coming up, we've really crammed a lot of them in there. I do a meal plan every single month. We have lessons that expand on different topics that people are asking questions about throughout each month. So there's a lot of content and support. Mostly it's answering people's questions. Honestly, that's where I spend the most of my time, is inside the membership. So if you're like, I did the Master Minerals course and I do want more support and you didn't know that it existed, if you go inside the welcome section of the Master Minerals course and click that, the last lesson is like looking for more support and there's a link in there, it is also linked many times throughout the course, but I know things like that are easy to miss. So that's what the membership is. For those that are wondering, you do have to be inside the course to join. The goal is that everyone has like a baseline of knowledge and the huge library of videos that I've created inside the course to refer to. But yeah, that's the membership. So I truly hope you guys enjoy this conversation with Dr. Blodgett as much as I did. Make sure you follow him on Instagram at Blodgett Dental Care so that you can help him share this very important message. One of the big questions I want to start with is, can you reverse cavities? And just more of your kind of like holistic approach with looking at a cavity. We had a lot of people that are either struggling with them currently or have struggled with them in the past and want like a better way to approach it in the future.
Sure. Well, it depends. No, I'm kidding. I'm kidding. No, it doesn't really depend. So the decay process is a continuum, right? It's not a magic thing where one day you don't have a cavity and the next day you do have a cavity. It's the result of health imbalance, both usually due to nutritional factors, as well as like internal wellness factors. It's kind of it's a loop, really. It's like, what are we putting in our body? How well is it absorbed? How well is that able to get to all the areas of our body, including the interior portions of our teeth where we have immune function? And how can our body deal with that like acidic onslaught? So what I would say is that if we appreciate that there is risk early, such that we use like an obvious scenario, like, we would probably all think of a high risk person for decay being someone who like sips on a Coca-Cola all day, right? That would be very obviously directed towards decay creation. What isn't so obvious, at least in my experience, is people hear things on health podcasts like, you've got to do lemon water and apple cider vinegar in the morning, and so they go to it, or sip on kombucha, or something like that, and they go do it, and they'll do it to the extreme, right? Where they are guzzling down lemon water and apple cider vinegar and wonder why within 6 months or so, let's say, their teeth become sensitive. And then the next time they see their dentist in a year or 2 or 3, if we're keeping it real, because that's how it goes for a lot of folks, and they're like, what happened here? Well, did anything shift? And of course, the traditional approach would be they update the x-rays, they see dark areas within teeth, and then just immediately start rattling off, well, okay, Josie, it looks like we're going to have to do an MO filling here and a DO filling there, and you know what I mean? Or a crown there. Oh, this one looks like she needs a root canal. And nobody's asking, what happened in your diet? Did anything change? Let's try to understand the system that created or allowed this to happen. So I guess the short answer is you can absolutely reverse the risk for decay. You can even have a frank cavity in a tooth that you can get to go biologically dormant. Now, I'm not advising that people don't appropriately manage their decay, if whatever that means for them. But it is possible to reverse the risk that acidic onslaught is causing and the damage to the tooth. You can make it go dormant through your nutrition, through your diet, sometimes, through using ozone. I personally am not a user of silver diamine fluoride, but it's also an option. If somebody's at a high risk, I'd rather them use something like that than just start taking teeth out, because the risk of losing your teeth, particularly at a young age, is significant. Our ability to chew food is, obviously very important. So it is possible to make those changes, but you have to be supported by a team with, hopefully a biological dentist, or it doesn't even have to be biological. Like, I don't want to overuse terms. Like, just be a dentist that cares enough to know about nutrition. So, but usually you have to have a team that can acknowledge that something must have shifted. Something must be in play here that if we could change this, and of course that requires the that human being on board enough to change living habits, which, that's always easy, of course, right? I'm being
Yeah.
sarcastic. I'm being sarcastic. But, if the desire is strong enough, I find that most people, when we frame it in the context of the health goals that they have, then I find that most people willingly will make those changes. So we spend a lot of time conversing with people and we don't tell anybody what they need, and we don't tell anybody what they should do. So we drop those words from our vocabulary in my practice. It's actually like when people come to work for me, it's the first thing they learn is like, we don't say need, we don't say should. So how do you converse then about health goals without saying those things like we were trained to do in school? So it's very thoughtful.
I love that. I love that you're opening up the conversation and really making them part of it and having them make the decision, because I mean that's what it's all about, and like working with your patients versus, just telling them what to do. I think that's what most people are looking for. They're not used to that type of experience when they go see a doctor or a dentist. I'm curious, if you mentioned ozone, which we definitely will talk about. How do you feel about oil pulling?
It's awesome.
Is that something that you feel like can help with cavities?
Yeah, I mean, again, so here would, and yes, it's another one of those, it depends. So let's say you've got Jane who's sipping on her kombucha 4 hours a day, right? And then she picks up oil pulling. The 10 minutes, if she's willing to do oil pulling for that long, most people aren't, right? Let's say that she was doing 10 minutes a day. That 10 minutes a day of rinsing soap, I mean, that's what you're creating when your salivary minerals mix with the oil. You're creating soap in your mouth, which you expectorate and, toss it down the garbage. That will not overcome the chronic acidic exposure. I have found people who, and of course, I'm sure this makes sense. Most of the people who find us, they've already made a lot of positive health choices in their life. They're, for lack of a better term, they're probably on a green diet. They're eating pasture raised, grass fed beef and, following a Weston Price mindset of nutrition and that sort of thing. So when they ask about like, could this be helpful? You bet, if you're willing to spend the time to do that. I have seen some people take that on as a practice and we see amazing results. Some people don't want to actively swish and use their oral muscles like that. And we might recommend for them something like PerioProtect trays, where you make a customized set of trays that delivers hydrogen peroxide under the gums. There's different ways of going about it. Some people might really find a water pick to be effective, or any mixture of those things. Ultimately, I see that people find what works for them and what's comfortable for them and what creates good results for them. And I say, great. When we see them in the office and things are looking healthy, it's like, I don't care what you're doing, just keep doing it because it's awesome. You look healthy, you look vibrant, your teeth are in good health, your gums are in good health, you're not inflamed. Like, that's awesome stuff. So yeah.
Step one is like removing whatever is acidic. And then step two is just finding like whichever therapy is going to work best for
Yeah,
you.
and it's also important to look at, is the person who's dealing with, whether it's gum health issues or decay risk, like what else do we understand about their health overall? Are they taking medications? I mean, one of the first things we as dentists have to know is, are you taking any medications that might shut off your saliva? Because, your teeth have to be bathed in saliva constantly, or the biofilm that inhabits our mouth, which of course is the start to the whole GI tract. The oral microflora starts it all. So if you have no saliva there, it's going to be out of balance for sure. So that's massive. Like, we're looking at people's tongues, at the quality of their gums, not just do they bleed when we jab out them, So that's a huge part of it as well, is looking at the whole health picture. Are they experiencing systemic health issues, And are they related to the teeth, and how so? So it's, we kind of see this thing it's a constantly moving system. Everything's connected to everything. And what happened in their history? I was just talking with a young woman. Well, she's a lot younger than me, so she seems young to me. But she was sharing 30 years ago, she was getting out of her mom's car when she was 5 years old, tripped and landed on her face. Tooth subsequently died, and she was sharing how, as she became a teenager, started to menstruate, how things were very different from what her friends were experiencing. And of course, this is like, on the ovarian and uterine meridian. And it's like, gosh, that would have helped to know when she was 5, right? So they could have prepared, or at least had some methods available to help support her in that energetically. Could have been some acupuncture, right? So, but anyways, it's all looped together. And here she's suffered for 30 years. Interesting to hear her story too, about how long it took for her to get pregnant and the hoops she had to jump through to battle the energy that her body was missing because she has a dead tooth.
That is so interesting. So can you explain the meridians a little bit?
Sure, sure. And what I would also offer to anybody who's listening, there is a book. I forget the guy's name. He's a MD physician out of England who then got a second doctoral degree in Chinese medicine. And he wrote a book called The Spark in the Machine. And he explains how and why the concepts of acupuncture even work, and teeth, which stem from the same tissues that our central nervous system stem from when we're in the embryological state. Your teeth are connected to all that energetically. So when something happens to a tooth, and something could be decay in a tooth, it doesn't even have to be dead. It's creating an inflammatory state or an inflamed state that could raise the energetic flow of every organ that is connected along that meridian. And of course, you can go to my website. There's a heading that says connections. And when you go onto that heading, one of the buttons you can press is, it's like an interactive meridian chart. And it's so cool. You can go on and click on stomach, or you can click on lungs, or some sort of organ like that. Or you can click on a tooth that you maybe just had a root canal on, and see what's connected to that. So energy flows through our teeth just like it flows through every other part of our body. And when the tooth is either inflamed or in a deflamed or dormant state, when it's dead or had a root canal, that equally has an impact just in the opposite direction. Now you're reducing flow of energy through not only the tooth, but the organs that are connected to it.
That is so interesting. So I found it on your website. I'm going to put it in the notes for
Awesome.
this class so you guys can all nerd out, and I put the book title so I'll find the author and everything. But I actually haven't heard of any of that. So that's really, really cool, and something I can nerd out on
Yes.
now.
There's another book that I would encourage you to read first if somebody really wants to get into this. It's called The Body Electric. And it's written by an orthopedic surgeon who in the 1950s, 60s, and 70s was studying like the why behind regeneration. Like, how is it that, say, a salamander or whatever, can get a tail cut off and it will regenerate? Or that children before a certain point could cut off the tip of a finger and you could regrow it, within a certain age range. But then beyond that certain age range, usually it will not regenerate. And ultimately what he proved was that the amounts of energy necessary to create that level of regeneration are ridiculously small, but yet they exist. And when he was first testing, it was like the levels were way too high that he was testing, of course, because we're like, well, gosh, if we don't feel a shock, how's it not having an effect? But of course, everything in our body is so subtle. Like we don't feel the beat in our heart. We don't feel the energetic charge that is required for our heart to keep beating, yet it exists. It's just all so fascinating. But
That
those
is.
books help me. I mean, again, I'm no expert in Chinese medicine. I'm not an acupuncturist. What I am is an oral healthcare provider who has seen live over years now the benefits of rebalancing energy and removing toxic chronic sources of infection for people, and truthfully just listening to what they share, because there's so much power when somebody says, you know, doc, I just feel like, and then it's like, okay, it's time to shut up and listen, because they're about to share their truth. And it's just a powerful tool that our team members have picked up over time to acknowledge their truth, to address it, to honor it. And lo and behold, when we do, people start getting healthy again, which is really cool.
I feel like people know intuitively too. Like they might not know exactly what's going on, but when you do let them talk things out and like share their what they've kind of seen on their own journey, because everyone's, I mean, by the time someone gets to you, I'm sure they've done a ton of research, right?
Yeah.
They're like almost an expert on their own health and their own bodies, or they are an expert on their own health and own bodies. So I always find them like, what do you think? Like how do you feel about what I'm recommending for
Yeah.
you, because so I think it's great that you guys do that. I'm curious about this one, like kind of piggybacking off the cavity question. Someone asked about tooth powders with clay and can they remineralize teeth and reverse cavities?
Yeah, it's a good question. I think it aids in the potential for that. And of course, it depends on, again, like it's the whole solute and solvent concept. Like, how are you playing chemistry in your mouth? You know, do you have the one thing that you're, so let's think about it in this context. The one thing that your teeth are constantly exposed to, assuming you're not, literally having a straw in your mouth sucking on Gatorade all day, is saliva. So in order to have healthy saliva, you have to have healthy blood. Your saliva is a distillate of your blood. That's where it comes from. So if your blood pH is imbalanced, which can happen for any number of reasons, that's going to be a problem. So again, we have to look at gut health. I was just in a class this weekend, actually, where one of the founders of functional medicine, Dr. Lodog out of New Mexico, was there speaking to us. We're talking about things like just what an atrocity is that people are taking, what are like proton pump inhibitors, to shut down acid production so that they can, treat their GERD. And it's like, dude, that acid is there for a reason, right? If you don't have acid, you're not going to break down your proteins. And if you don't have your proteins, the whole list just goes, it's like, yet all we care about is like, I don't have acid in my mouth.
Yeah.
It's such a mess. So anyways, yeah, I know that's kind of a circuitous way to get to the tooth powder question, but it's like, I don't care what toothpaste you use, what tooth powder you use. Most people are going to have it in their mouth for less than 2 minutes. If you brush your teeth and whether you're using Crest or you're using Tom's of Maine or Revitin or, there's a million, so many brands out there.
Yeah.
Like it's your saliva that the teeth are exposed to constantly. So the healthier your saliva, the healthier your teeth. And of course, that requires optimal gut functioning. It requires that you have great exposure to all minerals, that you eat a diverse diet. Ideally, that you would be eating a whole foods diet, that, you're not eating like squeezy cheese and, taquitos or whatever, right? It sounds ridiculous, but like that's the standard American diet. So, if people want healthy mouths, they've got to think about their entire body. There won't be a miracle powder that just suddenly makes it like, hey, everything's fine now, and the sooner people can think of that, and hopefully it starts with parents who understand that for the sake of their children who are born and have the opportunity to breastfeed. And, it's this whole concept of nature the way it was supposed to be experienced, life the way it was intended to be experienced, We've just grown up in a weird time where you can get everything at a quickie mart and, feed a baby out of a bottle. And, that's a whole different topic of conversation, right? Which is like underdeveloped jaws and things like that for these children that then of course need braces at age 10. And it's like, where did all that stuff start, right?
We
It's
have a
really,
dental health question for kids too. So that's a
which I will clarify, I'm not a pediatric dentist. I'll give you the name of the dentist you want to interview for that. But
okay.
uh,
Um,
I do have an adult only practice, but I have children and
yeah.
I've watched them grow, and I appreciate, I've read Stephen Lynn's book, The Dental Diet, which he covers child development incredibly well. Um, so anyways,
So do you have a toothpaste that you recommend to your patients?
we have lots.
Okay.
Um, and I get samples of all sorts of things. Again, I don't care. It's like, what soap is best for washing your car? I don't care.
Yeah.
Um, you know, I know what I like, which is a relatively non-toxic toothpaste that reminds me of the flavor and clean feel experience I had as a kid, right? I still love and always have, thank God, that feeling of a clean mouth. Fortunately, I've never had oral health issues. Um, and so, I mean, that's how and why I choose. I try so many of the natural versions of toothpaste, which leave my mouth feeling off. Now, do I think I could get used to it? Probably. Um, it's kind of like, is a silly analogy, like this has happened many times in my career where it's like I get the perfect fitting glove because I got to wear them all day long, right? And same thing with masks, and then they discontinue them. It's like, oh no, what am I going to do? And now we got to find the next best fitting glove. And it's like, why do I like it? Well, it's because it's what reminds me of what feels comfortable. And I feel the same way about toothpastes and products. That being said, y'all are probably familiar with the Healthy Living app that the
Mhm.
Environmental Working Group puts out. Um, that's a great app that you can go to the store and click on the barcodes of products, and it'll give you a relative toxicity score. So 1 being the lowest, 10 being the highest. And I love that stuff. My wife got introduced to the Beauty Counter company years ago, which probably like 8 years ago now. And that's what stimulated me thinking about what's in the products we use. I was like, gosh, I never really thought about that. And such a blessing, because it has, majorly impacted not only the products and materials we use, but the degree to which we are sensitive to the fact that not all products are compatible with all people. We actually had a new patient come in today who had pre-sent to us what's called a biocomp analysis. So she had a blood test done where they could analyze, do you have any immune responses to any of the products that are on this list? Now, the limitation is that your results are only limited to the products on the list. But that being said, there's a ton of products on the list. So it's a healthy thing. If anybody finds or is interested in investigating that for themselves, Biocomp is a pretty cool company. I've worked with them a number of times. They're also related to, if anybody follows my Instagram handle, and which is at Blodgett Dental Care, shameless plug, that the DNA connections reports that we send out when I extract teeth and I send the roots in for DNA analysis for pathogens, it's the same parent company that owns Biocomp and DNA Connections. Just wonderful people. Like, I know the owners, and they've really got their heart in the right place for healthcare, which is cool.
So that gives you insights into like if you would be reacting to certain products that are out there, or ingredients in those products, so that you can find the best ones for you.
Particularly like for dental products.
Yeah.
So let's say um, you went in and you saw your dentist and you had 3 mercury fillings in your mouth, and you're like, I know this stuff, it's constantly exposing me to mercury. I'd want to have them out. And so your dentist is like, great. But you also know that you tend to be sensitive to, whatever, whether it be, you're sensitive to certain earrings, or you're sensitive to certain foods, or what have you. Like it might be helpful to know in that process of putting bonding agents, composite resins, potentially ceramics, are any of those things, like, are there any brands that tend to be better for you than not? What we do here in our practice is, when 99% of people test healthfully for these certain brands, that's just what we keep around. Um, it's rare. I don't even know if I have ever seen somebody who is sensitive for the products that we keep around. They're way more expensive and they work, so it's like, that's the level of care we want to offer to our guests. So,
That's so interesting. Someone actually had a really good question about like either like treatments or products to avoid when you're at your conventional dentist. And I feel like that's kind of how you would get that answer, is to figure out which ones you react to.
sure. I will say, we're keeping in mind, you're talking to a dentist who might be inside of a fraternity of less than 100 people
Yeah.
internationally, right? And we're all geeky, and I know most of these people that are on this plane, but when we think about the local DSO dental group, whether it's Heartland or whatever, where you're going in, and let's say you had two teeth that were experiencing decay that had gone into the dentin, you generally have to clean that out. Otherwise, your tooth will suffer long-term consequences. Half of the dental practices in America are still putting mercury fillings in those teeth. And they're still, this is insane, right? But they're still telling the patient, well, there's no science to say that it's not healthy, and they're the strongest fillings, and it's crazy talk. As a matter of fact, and I'm guessing none of you all follow the Journal of the American Dental Association, but uh, uh, 2 months after COVID hit, and I swear to you, I absolutely believe this was done out of opportunism, that the American Dental Association released a press release saying, we do acknowledge that mercury vapor is released from all mercury fillings constantly, as long as they're in your mouth. However, we still believe that unless you're a child under 6 or a pregnant woman, it's still safe. So it's kind of interesting, when the whole world was looking elsewhere, they snuck in this thing that nobody paid attention to. So even the American Dental Association has acknowledged, like, it is a constant exposure issue. Now, if you happen to be a fast detoxer, well, maybe that's no big whoop for you, and you don't have to worry about it. But when we know it is the most toxic neurodegenerative substance you can get exposed to, who would want that in their mouth? And the same thing, sorry, I'm just going to add this as well,
Yeah.
Amanda, that similarly, how often have you gone to the dentist and they're like, just out of routine for no other reason, like, okay, we're going to get out your fluoride varnish or your fluoride trays. Now think about this for a minute. And I'm 50, so I can remember in the 1970s going into the dentist, they'd fill up the foam trays and stick them in your mouth for 10 minutes. You tell me, is that fluoride sitting only on my teeth? Heck no. I mean, it's all over my buccal and lingual mucosa. It's like, where do we put drugs when we want them to absorb instantly? You put them in the oral mucosa, right? So it's dangerous stuff. People are getting exposed to toxic loads of substances we know are neurodegenerative. They break down your brain and other nerve fibers. And we wonder why. That's like, it's odd, I guess you just have multiple sclerosis or whatever. It's like, think about the dental contribution to that, especially for those people who've been brushing with a fluoridated toothpaste for 40 years.
I'm sure, I think we've talked about this in another class that we did, but I used to, when I was in elementary school, they would do the fluoride swishes, like they bring in the trays of the fluoride. I mean, we did that all the time, and it's crazy, like when you think about it. And yeah, like right on your gums, right? If you want to absorb it
Oh,
sublingually, you'll absorb it
oh,
super fast. So
yeah. You think about it, like oral and nasal mucosa. I mean, why do people put nitroglycerin tabs under the tongue when they're having heart issues, or why do people, sniff things through their, like drugs through their nose. And it literally, I mean, you absorb it instantly. It's so powerful. Yet, if it has to do with doing dental care, like, no, doesn't exist at all. It's all, we're going to keep the argument all to your teeth. And it's crazy,
And it's interesting that they came out and said how, like, if you're not under a certain age or if you're not pregnant, but it's like, what about all those women that get those mercury fillings and then they get pregnant?
Yep.
That's a huge concern.
It's massive.
That's so crazy.
Yep.
A gum question. So we have a few people in the membership that specifically have been dealing with receding gums like for a while. They're wondering what causes receding gums, and is there any way to reverse it that isn't a gum graft?
Yeah, no, that's a great question. And I think part of along with that, I will add, like, when, does it always necessitate treatment? Can you have recession and just leave it? I mean, so that's something to consider. So, the short and sweet version of why we see gum recession is that understanding, in order for gums to be at any place in the mouth, it requires that you have bone underneath it to support the gums. So the gums will follow the bone. Okay. So imagine, I'll give you one version of how this might happen. Somebody, at 25 years of age has crooked lower teeth, and they go to their dentist or orthodontist and say, hey, I want to straighten my teeth out. Okay, great. So they take these teeth that are all tight and everything and straighten them out. Meanwhile, you're reorienting roots so that the widest point is now facing, cheek direction to tongue direction, but your bony ridge isn't that wide. So what's going to happen? The bone will go away, the gums will follow it, and now you've got sensitive roots that are exposed. Now, whether that's a problem or not is a very individualized issue. Some people, they may have gum recession and their gums are in perfectly good health and their teeth aren't sensitive and it's not an aesthetic concern, and they, like, who cares, right?
Okay.
Whereas somebody else could have a 0.5 millimeter of exposure of the root, and it's like debilitating for them when they breathe in air, when they drink cold water or eat ice cream or anything. And it's just like, oh. Now, the other thing that is massively contributes to that can be the relationship of how teeth come together when you bite. So we see it for a lot of people who had orthodontia as children, or, like early teen years, mid-teen years, you're literally forcing teeth into positions that they never had a genetic map to say, go here. We're forcing that to happen. And then expecting for everything to be honky-dory after that. It's like they might look perfect. We might love them aesthetically, but nothing fits properly. Or they're fitting in ways now that have unbalanced force distribution, which will have either bone loss consequences or enamel loss consequences, which some people will just grind the living daylights out of them, or the top of the tooth. So it's interesting, like, to visualize the top of the tooth as enamel, which is super, super hard. Everything underneath it, the dentin, is flexible. So if the tooth keeps getting knocked in one direction, you're going to start losing tooth structure down at the gum line where the tooth can flex. And we see this all the time where somebody's imbalanced bite, the symptoms of that imbalanced bite is a sensitive root that has recession. So there's so many factors to consider. In our practice, we want to look at, like, go backwards, start from the start. When you were born, were you breastfed? How did your arch form the way that it did? Did you have orthodontic intervention? And if so, at what point in time? And you start looking at the roadmap of their life from an oral health standpoint and looking at how did it get this, to where it is now. And those are all really helpful things, I think, to consider prior to engaging in what you could call epigenetic forces of braces. right? Your genes didn't determine that you were going to force teeth in those positions.
That is
So it's
so
help.
wild.
Think about that,
That's
right?
like mind blowing me right now.
Yeah. Well, I was talking with a woman today where we were looking at her arch form. So what we take a series of photographs of people's smiles and their teeth and all this so that they can see what we see. Okay. So one of those series of photographs is your upper arch, and it looks like a upside down U, and then the same thing with the lower arch. And when you look at the two next to each other, you almost always can see how they fit. Okay. And in her case, I was like, well, when did you get your braces put on sometime before you were 12? Oh yeah, I was like, 10 and a half or 11. And you can tell, right? And the reason I asked her, it's like not like I was guessing. You can see that the arch form is perfectly symmetrical only to her first molars. But her second molars, which come in around ages 12 to 13, were much wider. So the orthodontist forced her into a shape, is directing traffic, so to speak, so that it would be a certain shape. And then the lower ones follow that. But when the second molars came in, the tongue was the influencing factor that said, no, 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 we're going to push you out here because the tongue wants to be so big. So it's so incredible to look at how all those things play a part. Airway, right? If you keep the size of the garage, so to speak. Imagine your tongue is the car and your arch forms are the garage. If you make a smaller garage, I mean, there's no braces for a tongue. You can't tell the teeth, the arches to be smaller, but then the tongue's the same size. It's going to create issues, whether it's airway issues, whether it's your tongue pushing on your teeth such that you can't adequately retain those forms, which who would want to retain those forms anyways if they're not functional? Um, so there's a lot to think about in each of those. Do I want to do orthodontic treatment? And of course, what kid gets that choice anyways?
I was gonna say, I don't think you really choose whether or not you're gonna do that. But so that's so interesting. So something for those people that were asking about receding gums to keep in mind. I wonder if that like plays a role. We had a lot of teeth grinding and jaw clenchers in the group as a topic that comes up often. And now I'm like, oh my gosh, did these people have braces? Like
Well, it's a question to ask, and and admittedly, I'm keeping this discussion more around people of our age and generation.
Mhm.
If you were to say, well, why might we see gum recession in somebody age 70 and older? Well, that might be a different issue entirely. Pretty much all the bones in our body, experience some level of change, which would be relative to your exposure to vitamins, D3, K2, your overall GI absorption, so on and so forth. Um, and frankly, also that level or that expression of oral health and periodontal health has a lot to do with genetics. Some people are
Okay.
more prone to inflammation systemically than others. You know, um, so it's helpful. As a matter of fact, it's very helpful that we can understand not only these days DNA information about people's oral microbiomes, but also their genetic inflammatory risk. These are things that we use every day to help better understand a risk profile for somebody if they have concerns about that or they're already experiencing expression of disease.
And we have
Pretty
a
cool.
few people commenting in the chat saying that they did not have braces, but one still has gum recession and grinding. So the grinding can be a contributor for the gum recession, correct?
Well, for sure. So, think about it this way. Um, again, in order to have recession, you must have bone loss.
Okay.
So we'll start with that. If we look at why do braces work in order, to move teeth? Well, if you apply a constant force on bone, it will change its shape and form. Now, force applied to teeth could look like a person who's chronically clenching and or grinding. So if those are occurring in a pathological fashion, the constant connection of teeth may result in bone leaving, as I mentioned before, if you're grinding and clenching, which could happen for a number of reasons, you're either going to have loss of enamel, loss of root structure, or loss of bone, which will yield recession. Or it could be a combination of those things. So, and that is dependent on the bio-individuality of each person that we meet. Everybody's different.
But those are definitely, it sounds like, if say like you are seeing whether it's a holistic dentist or conventional dentist, keeping those things in mind, like, okay, well, if I am still grinding my teeth and I'm getting this gum graft, like I should probably address the grinding so that I'm not going to continuously get gum grafts for the rest of my life.
Yeah. And I will say this too, that, gum graft, there are instances where it's like, okay, this is just the best solution that we have. Like the traditional gum graft, which I haven't done in 15 years, because we have better ways of addressing most areas of recession, honestly. But the traditional approach of let's cut into the roof of your mouth, cut out a section of connective tissue out of the roof of your mouth, and then tie it in somewhere else down here it can work, certainly. I've done it for folks and seen good results in certain cases. And in a lot of cases, it doesn't work very well. And the potential downsides, in my opinion, it's wise to consider what those downsides could be, namely that it might just fail. You might end up in a worse situation than you started with. For certain situations, in case the listeners here haven't been exposed to it. This is about 8 or 9 years ago. I was one of the first 20 dentists in the world to get trained in a technique called pinhole gum rejuvenation. To me, it's akin to gum grafting, like ACL surgery is these days, where it's all arthroscopic, compared to the old days when they would cut your whole knee open. So it's a method of being able to move your gum tissue back up over the roots. And it's not appropriate for everybody. But if you still have substantial enough scaffolding of bone, for a lot of people, we can regain coverage of roots. But you have to address whatever cause created that recession issue in the first place.
Yeah.
So a bite adjustment is almost always going to happen, because especially when it's localized recession, as opposed to just like complete arch recession. If it's localized recession, you can almost be guaranteed there's a bite factor related to that. So you've got to address that before you get to covering the roots.
So interesting. For the teeth grinding and jaw clenching, I feel like they kind of go hand in hand because they can both probably lead to issues with enamel and like bone and stuff. I'm sure you see a lot of this in your practice. What do you find are the different root causes for this for people?
For a lot of people, disrupted sleep and airway issues.
Okay.
Yeah. Which starts at birth.
Mm-hmm.
There is a pediatric dentist, I believe he's in Chicago, named Dr. Boyd, who an incredible guy. He spent a lot of his professional life trying to help people see, well, number one, if we could form arches by breastfeeding children from birth, that would be really helpful. But for those who don't experience that, how can you help them, hopefully before age 5, to get on track for expanding arches? Because if your arches of your jaws expand appropriately, you will generally see the nasal airway also expand appropriately. But again, you think about how many kids are in braces or sucking from a bottle from birth, and there's a lot of challenge with that in terms of the form follows the function. So if you have a bottle that really drops milk out of it passively, and they're sucking on a long artificial nipple, their arch form will follow that, guaranteed. So then how do you, let's say they're 15 years old and that's their arch form. It's like, well, that's really hard to overcome at that point. And it may have lifelong consequences. The issue, as we know, of sleep apnea and, sleep disrupted breathing and all that, it's real and it's huge. The challenge is there aren't really any awesome solutions. People don't want to wear CPAPs, mandibular advancement devices that a lot of dentists recommend will, if you wear it, screw up your jaw usually.
Okay.
You when you put a tensile load on pulling somebody's jaw out over years, you will lengthen these bones and you'll create a situation where their jaws are permanently open, which is not exactly what people want when they want good health, right? So a lot of that, to answer your question though, it's like that. I think sleep disrupted breathing is a big part of it. I think also I can just speak for my own self. Like I, express stress by clenching my teeth. It's part of like when I'm finding myself thinking and my team members come by and they're like, "Oh, Dr. Blodgett, you must be deep in thought." I'm like, "Oh yeah, oops, I'm grinding the heck out of my teeth." Um, and that's parafunctional behavior. Many of us do that. So it's helpful to become aware of it, I think. Um, but it's also helpful to appreciate for most of us, we're going to experience grinding our teeth throughout our life. There's
Mhm.
only so much enamel and it does not regrow, unfortunately. You can remineralize demineralized areas, but frictionally, if you've worn it down due to friction, it's gone. So
I found I'm definitely like a teeth grinder. And at one point, my dentist tried to give me a mouth guard. And I was like, I can't, I literally can't. There's like no way I can sleep with this thing in. And then I tried mouth taping and I quickly stopped clenching and like grinding my teeth at night. And so I was definitely breathing through my mouth, or like at least for
yeah,
part of the night, maybe not all the night, but a lot of people in the membership had commented about that. Like, try mouth taping if you're like grinding your teeth and stuff at night.
yeah, I've heard that from many folks. Absolutely.
Do you use ozone therapy for that as well?
In what way?
For the teeth grinders and jaw clenchers?
Um, how would you envision using? I'm just trying to understand what you mean.
Someone had commented about using that for teeth grinders and jaw clenchers for something with like energetic charge, I believe.
Right. So it's just a loop.
I know, and your liver and your gallbladder and all
Yeah,
that.
absolutely.
So, what for those that aren't aware of what ozone therapy is, because I know that's like something that you utilize a lot in your practice,
Yeah.
what is it?
Yeah. So ozone, that's a great question. Thank you. So um, I get that not everybody here is a science major. I wasn't either, right? My degree's in psychology. I
I
care
saw
about
that.
how
That's so cool.
yeah, I care about how people feel about ozone, right? So um, we're all familiar with it. Oxygen, we hear the term O2. So oxygen is, two oxygen atoms combine to form the oxygen molecule that we breathe in. So if, and here's an example we can all relate to, when lightning strikes and we smell that scent that's in the air from the moisture, from the rain and all that, and it has that very particular smell, which is that comes from ozone. When the energy drives through the atmosphere, some of the oxygen, the O2 molecules get split and you end up, instead of being combined, you end up with free oxygen atoms. Some of those will combine with an O2 to make it O3, which is energetically very unstable. Okay. But it's biologically compatible, except in your lungs and in your eyes. So if we want to have energetic shifts, whether it be in your sinuses, you can inject ozone gas, which will spread out three-dimensionally throughout your nasal compartment and sinuses. And if you have sinus infections, you can treat that non-invasively using ozone gas.
That's
It
so cool.
generally takes numerous, you have to come back 2-3 times a week, just keep at it, keep at it, keep at it. And we have seen people clear their sinus infections by using nothing but ozone gas. It's something we generally want to help people do. Some do it at home, they get a home unit and do it. It's not hard to do. It just takes the right equipment.
Okay.
Um, but that's ozone. It's O3, and it wants to break down very quickly. The instant that you inject it into oral tissue or any other place in the body, it is absorbed. Now, some people might be thinking like, I didn't think you could absorb gas or air, let's say, in the under the tissue. And in fact, of course you can't, but that's 80% nitrogen. So in this case, we're using only oxygen, which is absorbed instantaneously. And I don't know a human being that's allergic to oxygen. So when we're looking for some sort of modality, which is antibacterial, antiviral, antifungal, antiparasitic, completely. None of those things have any part of their cellular structure that can combat ozone. And it's completely biologically safe. Again, as long as you don't breathe it in. It's such a wonderful tool. So whether Dr. Nish and I are doing fillings on a tooth, we will ozonate over the dentin, which is where the nerves of the tooth are. We ozonate that to make sure that it's free of any microbes before we seal it up. Or when we're taking a tooth out, we're treating that extraction site with ozonated water and ozone gas. And it just, the impact results in people who heal well, who have very little to zero discomfort post-surgically, and who regenerate appropriately. That's awesome.
That's really cool. And it's so you can use the water or you can like actually inject it.
Yeah. So in our lab, we have a whole section. There's a poster that I've probably reposted 3 times on my Instagram because it always gets good response. People love it. Like, what? Oh, oxygen, ozone, what? But we are constantly all day long bubbling ozone, gas, and oxygen into this gallon-sized Erlenmeyer flask. And we're using it for oral rinses, like, pre-cleaning oral rinse, where it's the only liquid that we put into our dental units. So instead of having prior to ozone in our office, this is really gross, and every dentist is doing this. You're throwing in tabs of drugs that kill off the biofilm, which then you get the joy of, it getting into your mouth when they use the syringe. When you're using ozonated water, the only 2 things in there are oxygen and water. It's distilled water and oxygen. So, and nobody's sensitive to that. And it's so effective at cleaning those lines without any chemicals. It's a wonderful way to go. But yeah, we use it for all sorts of things. It's what I bought the first one, I think 4.5 years ago. We now have 4 units throughout the practice because we're constantly whipping up ozone.
Yeah, that's awesome.
Yeah.
That's really cool. You guys do it yourselves. So one other question about the teeth grinding at night. Someone just asked, what do you do for that with people? Is it just depend on what their root cause is?
Yeah, that you hit the nail on the head. Absolutely.
Yeah.
I mean, for some people, it could be psycho-emotional issues. For some, it could be they got out of braces 2 years ago and their bite is just not quite right. One of the things that we observe in people's, the way that their bites connect, is if something is even the slightest bit off, something will pay the price for that. You'll either grind it away, which most people do, or many people do, I should say. Some people will express symptoms more in chronic jaw, head, posterior head and neck and shoulder pain. And they're like, God, I'm always tight, And it's like, oh, well, look at that. This one cusp on one tooth is hitting before anything else. And it's like walking around with a rock in your shoe for 2 years. And you've been accommodating that imbalance, slight as it is, but still present. You've been accommodating for that by trying to posture differently, and it's exhausting. So yeah, but to your point, it could be, it is as unique as the person who presents,
And just kind of working backwards and looking at your health history and what lines up with you and trying different things.
Exactly.
So I know that you're not a pediatric dentist, but because now I think everyone's kind of what the heck with the braces stuff. I think everyone's super blown away by that.
Right.
Do you think it's better to just leave the teeth as they are?
Well, and I don't think there's a better or worse. I think you have to assess the health of the child and their history.
Yeah.
So if, there are a lot of kids where, from birth, maybe they were bottle fed and they end up with a small high arch, or a narrow, let me rephrase that, a narrow and high arch. if you can do something to help remorph that arch form at an early as early an age as possible, I think that type of intervention might have lifelong health benefits. Um, I think that in most middle class and up neighborhoods, what you see is, it's a social thing. It's fifth grade. Every one of your friends has gone to see the orthodontist. Some people are starting to get, braces on their teeth or Invisalign or what, and it literally becomes an issue of social acceptance, which I don't think is a great reason to choose to put your teeth in positions that God didn't intend them to be in. But by the same token, could the, you know, the could the influence of bottle feeding, and I'm just going to pick on that because it's easy, could that epigenetic influence equally have created an off-balanced issue? Absolutely, right? Which is why when we get off of what nature intended, we start to see more and more issues. So again, the short answer is it depends. Each kid is a unique individual. I can share with you for my daughters, you know, the interesting, my older daughter will be 20 in a month. And I remember when she was in that, preteen state. And of course, I was not quite on this path yet. And she had braces put on, and I took a class of epigenetic orthodontics right as she got into braces. And within 2 months, I'm like, oh crap, like, what are we doing? And honestly, God, she and I talked about it, and my wife, we all talked about it, and we decided, take them off. It's not worth it. Long term, it's not worth it. And if she wants to make changes, she can do that in the future. Of course, now she's almost 20. Her arches are well aligned. Now for my younger daughter, we found out when she was, I don't know, relatively young, like 7 or 8, she had a lower canine that was lying down in the floor of her lower jaw. And so we had to, talk about, what do we think would be safe to do? What does she want to do? And we gave her the choice, and she's a strong-willed, bright young lady. So I told her, if you choose to keep it, it'll probably be your favorite tooth. But sure enough, we rigged up a system because she wanted to keep it, where through some laser surgery and some very creative orthodontics by our orthodontist, he was able to safely bring that tooth into an appropriate position. And, now that was before she was 11. So we had to get that tooth that was supposed to come in around 11 anyways into position by that time so that everything else could keep tracking.
Okay.
And it's worked out moreover really well for her. And thank God, I mean, the tooth is working and it's functional and it's an incredible tooth. It is kind of her favorite tooth now.
That's so funny. So are you not Invisalign is very popular. I can't tell you how many clients I've had that kind of go through that process.
Yeah.
Do you kind of look at that similar to braces, like you're forcing things, or can it be different once you're an adult and your teeth are already formed?
Well, pros and cons, right? I mean, there's advantage and disadvantages to both. So the orthodontist I refer to more frequently than anybody else has been shifting over time to using more and more of aligner therapy. And it has to do with, it is more predictable. You can control the outcomes to a point significantly better than you can with traditional braces. Now that also depends on the experience and comfort zone of the practitioner too. Because if you've been doing wire bending for 35 years, you could probably do amazing things with traditional braces. But then again, if we slow down and we think about biocompatibility, how many of those people who are getting nickel titanium wires put into their mouth have sensitivities to metals? If their gums blow up, that's information. Granted, it's hard to brush your teeth with braces on, but that could be your gums saying like, I'm not so cool with the nickel in here. By the way, I can't wear nickel containing earrings. What are you doing putting that in my mouth where I'm going to absorb it through my gums and oral mucosa? In that case, using some aligners might be much more appropriate if you want to move teeth.
Okay.
They can both be good options. It just depends on what you're trying to accomplish and why.
And someone asked about recommendations for where to find people like you. I found you had a great Instagram post on this. So, guys, I'm going to put that in the notes because I'm not going to make him repeat that right now. I
Oh,
have
you're a
one last
gem.
question if you have time.
Oh, I got as much time as you like.
Okay. Because there was a lot of root canal questions, but you have so many blogs on your website about those that I'm like, do we want to spend time on root canal? And you talk about that a lot on your Instagram. Um,
It's my thing.
I it's
That's my slow jam
Oh my gosh, it's like
for sure.
you have some really great vlogs on it. A really interesting question around like what do our teeth need on a daily basis? Like what care? Because this is also like I was listening to another podcast with a biological dentist, and his kind of take is very minimal care for your teeth. So I'm curious of like what do you think daily maintenance as far as caring for our teeth looks like?
Yeah. Um, that's a great question. I get asked that a lot in a different, the questions often formed slightly differently, but I think it still applies that, um, and this will be different than probably what you've heard. Your teeth require you to love them first and foremost. And by that, I mean, like, create a space for having downtime and honoring the requirement of your body to experience parasympathetic state. When we are in fight or flight, constantly looking at our phones, running from one thing to the next, and we don't have good salivary flow, and we're snacking all the time, we're creating an environment and an experience for our entire GI system, which starts with the mouth, to be out of balance. It will be in dysbiosis. Um, so that's where I would start. Find that thing that helps you decompress and honor the physiologic requirements of your body to be healthy. Um, Second would be coming to understand for you, whatever that might mean, the needs of your GI health. You know, some people that might, it's going to differ from one person to another, which includes incorporating enough fiber, soluble and insoluble, to carry out, as you pointed out so beautifully, you know, your liver and gallbladder that are trying to get rid of all the garbage in your system that will be reabsorbed and recirculated, which includes going to your teeth. If you don't carry it out through the poop with some soluble fiber, that's going to be problematic. So, because again, if we want healthy blood, we've got to detox the junk out, because the blood's what makes your saliva, and the saliva bathes the teeth. So it's this loop. Now, in terms of the home care stuff, in my opinion, and maybe this is my own social norm, you know, I couldn't imagine not brushing my teeth in the morning and before I go to bed. That is a social norm I have grown to expect of myself, and it's what feels comfortable to me. We do have some patients who brush once a day. We have some patients that brush 3 and 4 times a day. That may or may not be problematic. It depends on the person. What I do find is that those who take it to the extreme, and for whatever reason choose, and I know this will sound a little interesting, but those who choose literally never to brush their teeth, we do often see dysbiosis, particularly when the foods of choice are of the processed variety. You know, if we sit around crunching on celery and apples and jicama, and, you know, foods that are not only healthy for our gut and offering prebiotics and all that, but also the crunchiness cleans the teeth. Like, that's pretty awesome. You know, your English cucumber with your hummus. You know, like, isn't that funny? My teeth feel pretty clean when I'm done eating that. If I go eat, you know, like a nougat bar, which I don't remember the last time I did that. Hopefully I haven't planted a seed for myself tonight. You know, like, you know, it's like within an hour, you're like, huh, that's weird. I got sweaters growing on my teeth, you know. That's your biofilm speaking to you. So we do find people who floss more tend to have healthier gums. We find that people who hate flossing, if you're able to incorporate water picking, they tend to do well. Like again, if they're practicing good techniques. Those who can't stand either, those that like to do oil pulling, that can be really helpful. So it kind of just depends on what works for you. But I think a basic level of clean at least once a day is really helpful at keeping the lawn mowed, so to speak. We don't want weeds cropping up here and there in the mouth. So
I love oil pulling, and I feel like that makes my mouth feel, I'm like the same way where I have to brush my teeth. I can't ever imagine not doing that or flossing. My mom worked at a dental office for 20 years, so it was like drilled into my head. But it's a habit. So even though I oil pull, I still obviously brush and floss. But it's interesting listening to other takes on it and how, like, if you're not flossing correctly, can it create more inflammation? You can get more bacteria into the gums. Like, that's always a concern. There's a lot of different takes, but I love that answer of like getting into that relaxed state and just not forgetting that there are so many other things that are going to impact that. And I think that's a huge takeaway from this interview that you reiterated really well throughout, that yes, like using a quality toothpaste is helpful. Eating well obviously is really helpful, but it's also just like looking at like how you're living, your health history, all those things are, were you breastfed, were you not, are you nutrient deficient, all those things are going to impact your
yeah,
oral health too.
one of the things that we've done in the past year that has been such a massive shift for the experience of patients as they leave, we invested in a Novathor bed. And partly it's like it's a full body red light and infrared light bed. So, from a red light and infrared light exposure standpoint, that's super helpful for your cells, obviously. What we have observed from a social emotional, psycho-emotional standpoint is that it directs people into parasympathetics immediately after surgery. And it's just so powerful when they come back and like, wow, I felt great. And because what we want them to do is go home and rest. And if we can help them get into that state of, bringing down like a lower state of energetic resonance, it's like, wow, this is awesome. I'm in a nice, cool idle right now. It's so cool. Yeah.
That's really
Thanks.
neat.
Thanks, Christy. She's like, love it. Yeah. It's pretty epic.
Do you use like the red light? Do you have red light that you use actually that goes inside your mouth?
Not inside. We have, and I've done this for almost 4 years now, as part of our protocol. So a lot of what I do, and I know you didn't want to go too deep into the root canals, but I will talk all night about root
Well,
canals.
listen, if you want to talk about root canals and you have time, you are so much more than welcome to do that.
It's my favorite, only because I see more than anything, people experiencing them because they're told they need them first and foremost. It's horrible language. You need a root canal. Why? I just came in to get my mercury filling taken out and you put in this new filling and it hurts like hell. Well, because you need a root canal. It's like, okay, we've missed the boat already. But so they go and they get it done because they're told they need it. And then all of a sudden, they start experiencing health issues in some other areas of their bodies. Not for everybody, but for many. So we had to develop a protocol that would predictably regenerate the tissues around these teeth. So as part of that protocol, I mean, that includes, the utilization of laser technology, the utilization of ozone. I had to get team members here licensed to be phlebotomists because we're drawing blood on people and using your own clotting factors and immune cells and concentrating them back in your extraction site. And utilizing the benefits of lymphatic drainage remedies, homeopathics, and red light therapy. So I found this red light therapy unit called a MedLight 630. So it's 630 nanometer red light.
Mm-hmm.
And we're able to buy them for reasonably inexpensive, about $150, which we don't upcharge them. We just sell them to the patient. Say like, we want you to use this and just keep it around the house, because guaranteed you'll bonk your elbow or the kid will, hit their forehead, and using red light to help cellular regeneration is awesome. So we just have people hold it, it's about so big. I know it doesn't look probably, there we go. About so big. When you just put it over the area of surgery. So some people might find like, oh, my TMJs can't put the red light on it, you know? I literally have the same unit at my house underneath the coffee table, because when things are achy, which they can be from time to time, you just pull out the red light. So yeah, we use light therapy. We've been using light therapy, using lasers and such for 20 years in our practice, and it works. That's why we keep doing it.
I have a huge red light in my bedroom that I use every single night before I go to bed. And one of my dogs got attacked and he had to have like surgery and stitches and all this stuff. And like every night I'd put him in front of the red light. I mean, they like it anyway because they're animals, so they're attracted to it.
Yeah.
But it like our vet could not believe how quickly he healed. Like they're like, we've never seen anything like this. I was like, I think it's the red light. We use it literally every night for like 20 minutes.
So beneficial. So beneficial.
That's
So
really
yeah,
cool.
as you can tell, like, um, from a root canal perspective, you can tell I'm coming back to it. So I believe every person deserves the right to understand all of their options. So, I do tell people if they come here and they had a crown put on their tooth and their tooth hurts like hell, and well, one option you could consider is you could take out the nerve and the blood supply and you could mummify your tooth and you could keep chewing on it for a number of years, especially if you just spent $1,000 or $2,000 on a crown. Some people are like, well, I know this might be adding insult to injury, but I just spent $2,000 on this crown. I'd like to keep using my tooth for another 5 to 10 years. And if they go into that understanding the potential risks that come alongside root canals, then I'm all for it. I won't do it because I don't do root canals. I did for 15 years, and you can only imagine how I learned how toxic they are. It's
Yeah.
firsthand experience, and I, there are many situations that I feel badly now looking back, and I'm like, well intended, but that was not, it was not helping somebody in that fashion. So, we do refer out to endodontists if they want it. As you might imagine, I mean, 99% of the people that come to see us is because they want their dead teeth out.
Yeah.
And they're telling their dentist, whether they're, in Salem, Oregon or Salem, Massachusetts, they've been telling their dentist, this isn't right. It doesn't feel right. I've noticed a shift in my health ever since I've had it done. And they're just hearing, no, it can't be your tooth, because they don't have an understanding or an appreciation of what could be going on. And because we've honored people's truth, regardless of how we felt about it, that's how we have learned more than anything, is observing firsthand. Like when somebody comes in here feeling like they're about to die, literally, and then they come in 2 weeks later, bouncing up and down and they're just full of energy. It's like, whoa, like, okay, how many other human beings have I missed the mark on because I didn't have my eyes open and my ears and my heart? When we think we have all the answers and we're going to tell you what we need, we've already missed the mark, which is why I started with, when somebody comes to work at Blodgett Dental Care, the first thing that they learn is we stop saying need and should. It's a mindset and a lifestyle working here more than anything, which is a massive benefit, not only to our patients, but the human beings that are employed here.
I was
They
going to say, it
become,
sounds like an amazing place to work.
yeah. And it is, and it's shared. We lift each other up and hold each other accountable to continuing to work on being our best human beings. So it's pretty cool.
So with
So
the root canal piece, like obviously if they want to keep their tooth, then it's like, then that could potentially be the route that you have to take. So if say they have that dead tooth, you would remove that. How do you feel about implants?
yeah. So, and I'll answer that in a second. I want
Yeah.
to share an interesting story, just because it kind of pertains to what we're getting at here. One of the new patients I met today, she had driven over from Bend, which is 3 hours away, right? It's a trek. And interestingly enough, her chief complaint was my lower left second molar had some bad pain. It has since resolved, so maybe it's okay. But I want to check that out and see. And here's what's interesting. We have people fill out a lot of information so we can go deep. One of the things I have to know is, what are your goals? What are your goals for your total health? And her stated goal was complete oral health. I'm like, okay, you know, or sorry, optimal oral health. Wasn't complete, optimal oral health. So we look at her 3D cone beam scan, and sure enough, the tooth that had hurt had abscessed because the nerve died because she had a big crown put on the tooth, and that type of an insult will frequently will kill the nerve of the tooth. So it died. Interestingly, she had 4 other teeth in her mouth, different locations, all of which had already had root canals, and all 4 of which were severely abscessing. And she was aware that pus was draining out constantly. It's like, well, I just rub it, you know? So it's like, yeah, I mean, this is my life, right?
Oh my gosh.
And it's like, we had to have, it was, oh my gosh, man, it was such an interesting talk because she was very resistant to hearing about it, you know? And I'm like, so tell me more about what it is that feel, you know, where's that emotion coming from? Again, you could tell I spent some time in psychology, right? And interestingly, what it went back to, this woman's 67 years old. We went back 60 years in her emotional life to a traumatic experience where she tripped and fell, hit her 2 front teeth on a bar, broke them off in half, and, you know, ultimately had to get root canals in order to keep the teeth. But she's still to this day emotionally scarred by the way her mother looked at her and was concerned about the way she was going to look.
Oh.
And it was like, my hygienist Claire and I just sat there with her and, you know, handed her some tissues and just said, you know, like, let it sink in, because, you know, we're now acknowledging that's at the root of this thing, right? And you're saying you want optimum oral health, but your behavior is saying, I don't want to know about my disease issues. And it's like, we want to help you work through that stuff. So there's always some emotions usually tied in with that stuff, whether it was the experience at the dental office and they were disrespected, or feelings of a family member and how they dealt with, you know what I mean? So
Yeah.
there's stuff there, and there's emotions, and we have to process it all to get through to a healthier state. Anyway, I apologize for that tangent, but I wanted to share it because it's so powerful to watch people work through that stuff. And you have to go through it. You know, you have to process the trauma. Because it's absolutely linked to the physiologic event. So anyway, sorry, remind me of your question about the root canals.
I think it was more just figuring out, you know, a lot of the questions that we've gotten are kind of like, what's the best decision for me, right? Because there are different options. But like you said, you do have to think about where, like, going that far back to that woman's like childhood and having that experience, like that was giving her resistance with the right decision for her now,
Yep.
which is pretty wild. Some people have asked about dental implants, because if you're going to remove that dead tooth, then do you feel like you should replace it, or does that depend?
Well, it's as you can imagine, I wouldn't say should about anything, but it's an option. So, you know, arguably a person can have a dead tooth removed. We can help their body regenerate itself very effectively and very predictably. And they could theoretically leave that space open, understanding that teeth could shift. And, you know, I mean, those are generally not life-threatening issues. You could remove teeth and just not replace them. And some people do. And sometimes we'll replace them with removable, like a single tooth removable piece, or a full arch removable partial denture. I mean, that's the way you could go, so that you don't have to go through surgery again. A lot of the folks that I see, and Dr. Niche, my partner here, we will help people take out teeth. And when we can, and if they want implants, replacing them, we will use ceramic implants that are energetically neutral. For, geez Louise, 20 years, I was placing and restoring titanium implants, right? The last one that I put in was maybe a year ago. And, you know, I think it was last year, Dr. Nish and I looked at each other like, I just think we're done with titanium. It might be the unique case that I would put one in if it was a right set of circumstances. There are certain titanium implants which are just so different from zirconia or ceramics that there aren't any ceramic options that are quite like that, but that's like the 1%. So the vast majority of implants we place now are ceramic. Um, they, your bone will attach to it. Not only your bone, interestingly enough, but your gums will attach to zirconia. It's so weird. Uh, it is white in color, which is very odd too. So you've got this tooth that comes out of the gum tissue that looks like a tooth. You can grind it and shape it just like a tooth, which is also very interesting. Um, I have found it's the way I would prefer to go if it were in my mouth. As a matter of fact, I've in the last 2 years had to replace 4 of my mom's teeth that were all root canal. 2 of which were abscessing and 2 of which fractured off, because once you root canal a tooth and it loses its blood supply, it now loses its source of moisture and it becomes much more brittle. So that's a problem when you put pressure, because you like to chew, of course, right? Who wouldn't? It was interesting, as a matter of fact, because once I replaced her lower 2 teeth that had abscessed with zirconia implants, when your bone attaches to an implant, whether it's titanium or zirconia, there's no forgiveness of that connection, versus your tooth, is attached by a ligament, which has a little bounce to it, maybe by 1/10 of a millimeter, but still a little bit of forgiveness. Implants, rock solid. So as soon as we had her implants restored, and then she started chewing on the teeth above them, which were root canaled, now it doesn't move. And, those brittle teeth having a different source of force now broke off. Oh, okay, well, round 2, here we go. So it even happens to biological dentist parents, right?
Oh, I was gonna say your mom's lucky that she had you as a resource for all that.
She's fortunate. So is my dad, but they have a good resource for sure.
What was the name of that pediatric dentist that you mentioned in the beginning?
Yeah. Dr. Stacy with an I, Staci Whitman.
Awesome. Because there was definitely some stuff for kids, but I feel like I'll try to reach out, and because I think a lot of people are either pregnant, they have children, some are young children, some are much older children in the membership. So there's definitely a range there. But I'm even just hearing the braces thing, there's some things to really consider when it comes to kids. And I feel like there's probably not a ton of information out there about that.
For sure. Her handle on Instagram is at the word Dr. DOCTOR _ Stacy.
Thank you so much. Okay, last question. How often should we be seeing a dentist?
That would depend on your goals, your risks, quite frankly. There are a number of people that I see where I tell them, we could see you every year or 2. They just maintain that level of oral health. If, and this kind of gets into my philosophy of healthcare. If your lifestyle practices are such that you're generally in good health, why would you be seeing a physician every 6 months?
Yeah.
Well, hold on, doc, I want you to check my blood work again, make sure I'm still healthy. It's I'm 35 and I eat, kale every day and my grass-fed beef. And you're like, dude, every time we see you, you're perfectly healthy and you jog and you do your red light bed and you got it all. So, and it's kind of like the same thing with dentistry. If you look at the remuneration model of dental care in America and how not only insurance companies, but dental service organizations are starting to take over, and dentists are getting compensated. They set up these businesses where people come in for worthless cleanings for a lot of people, meaning they literally run a polishing cup over the teeth, don't address anything under the gums and tell them they're healthy. It's a waste of time and money, in my opinion. But at the same time, there are people who literally are perfectly orally healthy. And it's well, welcome back. There's literally nothing to clean off of your teeth. What are you going to do for them? It's I feel bad taking your money. That's not kosher. And frankly, I want to spend my time helping people that actually could use it. Not so for some people, we might want to see them every 2 to 4 weeks. If let's say we're doing some ozone tray therapies and we're trying to arrest a biofilm process that has been giving them grief for 10 or 15 years or 5 years, whatever, we're going to want to see those people with high frequency, or we're doing some nasal ozone therapy to knock down some sinus infections, something like that. But for other people where every time we see them, they're healthy, come in once a year, come in once every 2 years, whatever. If they look great still at a year out, go 18 months. Keep doing what you're doing. That's my take is, if you're in good health, the things you're doing are making sense and they're working. Like, just keep doing that.
You shouldn't necessarily need to come in every 6 months. Yeah, I think that's because that's kind of the confusing piece. And it is like they don't really do anything. Like you're other
Well,
than the cleaning, which isn't always
how can
great.
people that are all so different all need the same thing? It's crazy.
Yeah.
Like, there's no respect or thought for bio individuality at all. Because we're not asking, tell me about your diet. We're not asking, tell me about your family history of oral health issues and systemic health issues. You might fill it out on a health form. How often do they actually ask you about it? For each one of our new patients that come in, it's at least a 2-hour visit, 2 hours for each person. Well, I mean, that's like when I say all we did today was see new patients, that's all we do. We're not doing any dental work.
Yeah.
We stop the presses, so to speak, so that we can be present for human beings. And the power of that is just incredible. But you also get to the base of what's actually affecting people's oral health and what's the appropriate trajectory for your health plan.
Mm-hmm. I love that. And I think it's a good thing to keep in mind. So I'm going to list, guys, there's 4 specific academies or associations that I know you recommended in that Instagram post. And then you have great instructions on exactly how to find the right person for you. So that's all going to be in there. I'm going to be looking at this. I had a bad experience with a holistic dentist recently, so I'm going to find somewhere else to go. But yeah, so this was amazing. Thank you so much for being so generous with your time, thoughtful with your answers. I just love your approach and how nothing is disconnected. Like the mind body is there, the emotional aspect is there, the physical aspect is there, and all the systems. So I can't thank you enough for just sharing your perspective.
Well, thank you. And I do want to add, because I think you just brought up something really, oh my gosh, it's so important. So how, I've been in dentistry long enough now that I have seen the terms du jour come and go. So, 20 years ago, it was, the term micro dentistry or minimally invasive dentistry was like this term. It was like a thing, people would say, or I'm a cosmetic dentist, right? 20 years ago, people would say, we're doing family and cosmetic dentistry. Well, I would sure hope you're doing cosmetic dentistry if you're fixing people's teeth, right? They show. So, but these days, the terms du jour are biological, functional, holistic. And just because you read it on somebody's Instagram page or website doesn't mean anything. I hate to say it, but like, you still have to do the due diligence. So the question I get every day, and I'm sure you can imagine, I get DMs like you wouldn't imagine on my Instagram feed, and I do my best to answer it. It's like, hey, who do you know in Houston? Who do you know in Poughkeepsie? And I'm like, well, first of all, if what you're reading here resonates with you, then that has to do with the energetic connection between you and me, because everything that's on there is from me. I don't have ghost writers. This is my life, right? I'm spending time expressing it. Just because, and I appreciate you mentioning my post, because there's good information there for sure. But just because somebody's a member of the IAOMT or the Holistic Dental Association doesn't mean that you won't walk in the doors and it's going to be the same as what you've experienced everywhere else. You have to find out how are they engaging with other human beings? That's where the rubber meets the road. Do they respect my autonomy? Do they respect my individuality? Those are what I find, like, and I know some, and I have a few dentists around the United States and outside, a handful where I'm like, yep, I know if you go to this person, you will be honored and respected. And I know you're going to have a good experience there, because I will not send you to like, well, I don't know. They're a member of this,
Yeah.
give it a whirl, because I don't want somebody to potentially have a negative experience. You can always try it, of course. But just do the due diligence, read reviews. If you're concerned at all, like find out who from that practice that's a patient that maybe had some teeth extracted, maybe had some ceramic implants. Who could you talk to so that you, I mean, person to person, um, even though I know we're in a digital world, right? Find out who you can talk to real life and just see like, who can I connect with and see what their experience was like? Because there's a lot
Yeah.
of power in that. Yes, or talk to Christy. Send her a message. That's what she says. God bless you, Christy.
Telling you,
Oh,
if I
love
weren't
you.
so pregnant, I'd be out in Portland. I had a terrible experience. So I'm probably gonna have to end up waiting until after I have the baby. So we'll see. But yeah, it's like you can read reviews. Not everyone has an Instagram like you do, like a great thing, which is great. But yeah, so it's not difficult. I feel like it takes time to find the right person, but if you do enough research, and everyone in here is so nerdy and willing to do all that. So
Yeah.
I'll make sure I post all that in the notes for this guest expert interview in Kajabi. And then I'll put that, because I'm going to put some of this on the podcast too. And so that will be in the show notes as well. But yeah, thank you so much. This was amazing. I really appreciate you sharing your expertise and all your time. And anything else, I'll your website, your Instagram, that'll all be everywhere. Anything you want people to specifically do, follow you on Instagram, Blodgett Dental Care.
I would ask a favor.
Yeah.
My goal is to reach literally millions of people because I want for the human population of this planet to understand that they have options. And sadly, I absolutely know that in most people's experience, they will not be given all of their options. So what I would ask is that if you could send out my Instagram or whether you watch Facebook or Instagram to every single human being you know, and just it will at least create pathways of awareness for probably some people who aren't yet aware. And that, I mean, you never know. And I don't say this with any joking at all. You don't know whose life you might save through that, right? Somebody could be at the edge of a cardiovascular event and death, or they could be at a state of being chronically, in so much discomfort from oral pain that they're ready to end their life. You don't know whose life you might save by sharing that. So I would really appreciate if you would send it out to the hundreds and thousands and tens of thousands of people that you know, so that we can create awareness together and improve the experience around oral health, because it can be an insanely positive and wonderful experience. But most people, as we know, that's not their experience. I mean, we have to literally change the entire industry, which the only way, in my opinion, that's going to happen is when the public becomes aware and demands better. Then it will have a change, much as we've seen in our food industry and that sort of thing, right? We're seeing more choice, or in cosmetic industry, like there's more awareness, there are more choices now. We're barely at the cusp of that for oral health. So together we can do that.
I know, I think people just aren't educated. And so when you don't have that, like you said, you don't know your options, you don't know what to ask for.
Yep,
So
totally.
awesome. Well, everyone share Blodgett Dental Care's Instagram. This will be in my podcast, my newsletter, all over my Instagram. Yeah, maybe we'll do a live together eventually and hit all the different audiences. But yeah, thank you so much for being here. And I hope that you get to go relax and unwind your brain after all those new patients today and then doing this interview.
Well, you know what time it is. It's time to go finish Toxic Tuesday for tomorrow. Got to set it up. Oh, it's going to be a goodie.
What is it going to be about?
We'll be talking about that even getting small fillings can have massive degradatory effects on teeth. When you disrupt the structural integrity of a tooth by drilling into it, no matter how small, the structural integrity is now gone. And the risk of that tooth splitting partially or completely in your lifetime goes through the roof. And I've got a lovely tooth with a big crack all the way through it, to show everybody. It's going to be awesome.
Oh, that's like literally what I was trying to see that holistic dentist for, a filling. So I will definitely be watching that one and I'll share it on my Instagram. It's just such a somehow it's like my regular dentist is like, nope, you need this filling. And I'm like, but are we sure this is the best
Yep.
option? And again,
Oh
like,
yeah.
become empowered, share this information.
Thank you.
Awesome. Thank you so much. I hope you have a great rest of your night.
Yes, and thanks to everybody. I appreciate it.